portion of nervous system that controls the visceral function is called as autonomic nervous system, and most striking feature of autonomic nervous system is rapidity and the intensity of action. Anatomically, it is classified into craniosacral flow and thoracolumbar flow. Craniosacral flow, where cranial output supplies the visceral organs via 3rd, 7th, 9th and 10th cranial nerves, and sacral outflow supplies pelvic viscera via pelvic branches of S2 to S4, and they are parasympathetic fibers, whereas thoracolumbar outflow, the outflow comes from mainly T1 to T12 and L1 to L3, mainly the L1 and L2, and they are sympathetic fibers. Physiological classification is either they are sympathetic fibers or parasympathetic fibers. Sympathetic are thoracolumbar anatomically and parasympathetic are craniosacral. Chemical classification, whether they are cholinergic or adrenergic nervous system. The cholinergic, the neurons that produce acetylcholine, they are all the preganglionic fibers, the anatomically parasympathetic postganglionic neurons, and the anatomically sympathetic ganglion and sympathetic postganglionic neurons that innervate sweat glands, and anatomically sympathetic neurons that end on blood vessels in skeletal muscles and produce vasodilatation. Whereas adrenergic fibers, they producing epinephrine or norepinephrine as a neuroeffector junction, and they are found in sympathetic postganglionic fibers except sweat glands, piloerector muscles, and some blood vessels of skeletal muscle and adrenal medulla. So ANS includes the following structures: the areas controlling visceral function located in the cerebral hemisphere, including part of cerebral cortex, limbic system and hypothalamus. And it also includes autonomic centers in the brain stem and in the reticular formation, which contains cardiovascular, respiratory centers and cranial nerve nuclei, that is 3rd, 7th, 9th and 10th. It also includes autonomic center in the spinal cord, that is the lateral horn, from where sympathetic thoracolumbar or parasympathetic sacral output comes from. Then it also includes peripheral part of the ANS, that is autonomic nerves and the ganglia. Coming to sympathetic nervous system, sympathetic fibers originate in the spinal cord along the spinal nerve where its body is located. From there, they first go to the paravertebral sympathetic ganglia chain and then to tissues and organs that are stimulated by sympathetic nerve. Preganglionic fibers, which are usually myelinated B fibers, originate from lateral horn and pass through anterior root immediately after the spinal nerve leaves the spinal canal. These fibers then leave the spinal nerve and pass through white ramus into one of the ganglia. From the ganglia, the course of the fiber can be one of the following. Most of them, they end on the cell bodies of postganglionic neurons, and some fibers pass upwards or downwards in the sympathetic chain and synapse with ganglia at higher or lower levels. And some end in peripheral sympathetic ganglia other than preganglionic and postganglionic. Postganglionic fibers originating from the ganglia innervate various organs. Some of the postganglionic fibers pass back from sympathetic chain and enter spinal nerve as gray ramus communicants, which are unmyelinated C fibers. These fibers enter all parts of the body through spinal nerves and supplies blood vessels, piloerector muscles, etc. This is the diagram showing the sympathetic nervous system, where it arises from the lateral horn of the spinal cord. Okay. Then they are going to form the sympathetic ganglion. Some of the preganglionic fibers, they relay in the sympathetic ganglion. From there, they are going to form post-sympathetic ganglion. And some of the post-sympathetic ganglion, they come back to the spinal nerve through gray ramus communicants, and they supply to the blood vessels and various glands. Some of the postganglionic fibers, they directly they going to innervate the viscera, and some of the postganglionic fibers they form collateral ganglia close to the viscera, and from there they are going to form postganglionic fibers. Sympathetic nerves also extends to adrenal medulla. Preganglionic fibers originating from lateral horn pass through sympathetic chain into splanchnic nerves. Here there is no synapse. Splanchnic nerve enter adrenal medulla. In adrenal medulla, they end directly on modified neuronal cells. They secrete epinephrine or norepinephrine directly into bloodstream. Postganglionic neurons are modified into secretory cells. 80% of the secretion of adrenal medulla is epinephrine and 20% is norepinephrine. Coming to parasympathetic nervous system, 75% of all parasympathetic fibers are from vagus. Vagal fibers supply heart, lungs, esophagus, stomach, entire small intestine, proximal large intestine, liver, gallbladder, pancreas, and upper portion of the ureters. Oculomotor fibers supply pupillary sphincter and ciliary muscle. Facial nerves supply lacrimal glands and submandibular glands. The glossopharyngeal supply the parotid gland. Sacral fibers are through pelvic nerve. From the sacral plexus S2, S3, S4 supply the portion of large intestine, external genitalia and lower portion of ureter. In parasympathetic system, ganglia is located in or near the organs. So preganglionic fibers are long and postganglionic fibers are short. So this is the craniosacral flow of parasympathetic nervous system, where the cranial nuclei are the 3rd, 7th, 9th and 10th, and here the preganglionic fibers are very long and postganglionic fibers are very short. So similarly, sacral output from the lower sacral segments, the S2 to S4, here also you can see the preganglionic fibers are long and postganglionic fibers are very short. Neurotransmitters of autonomic nervous system, mainly acetylcholine, adrenaline and noradrenaline. Acetylcholine is present in all ganglia and in adrenal medulla, especially preganglionic sympathetic fibers, and postganglionic parasympathetic endings and sympathetic cholinergic nerve endings, whereas adrenaline and noradrenaline, they are present in the postganglionic sympathetic nerve endings, which produce mainly noradrenaline, and in adrenal medulla, the postganglionic sympathetic fibers, they produce adrenaline. Synthesis of these neurotransmitters, acetylcholine is mainly synthesized in the terminal end of nerve fibers and it is stored in vesicles. Acetyl-CoA and choline, they are going to form acetylcholine in presence of choline acetyltransferase, and acetylcholine is broken into acetate and choline by the choline esterase in the synaptic cleft. Then epinephrine and norepinephrine, they are produced in the exoplasm of the terminal nerve ending. They are mainly produced from tyrosine. Tyrosine gets converted into dopamine and norepinephrine. So eventually there will be hydroxylation, decarboxylation and hydroxylation action, which are going to lead to the formation of norepinephrine. In adrenal medulla, norepinephrine gets converted into epinephrine by methylation. Fate of noradrenaline, it is reuptaken into the terminal nerve endings and are diffused into the surrounding tissue fluids. Some of them are destroyed by a catechol O-methyl transferase, and adrenergic and cholinergic receptors are seen on the effector organs. Adrenergic receptors and cholinergic receptors. The adrenergic receptors classified into alpha and beta, and again there will be alpha 1 and alpha 2, and there will be beta 1 and beta 2. Note that alpha 1 and beta 1, they causes excitation, whereas alpha 2 and beta 2, they are mainly inhibitory in nature. Whereas cholinergic receptors are nicotinic and muscarinic. The nicotinic receptors, they are present in all autonomic ganglia and neuromuscular junction, whereas muscarinic in the neuroeffector junction of smooth muscle and glands. These are some of the difference between sympathetic and parasympathetic autonomic nervous system. Here, sympathetic is thoracolumbar and parasympathetic is craniosacral. In sympathetic, preganglionic fibers are short, here they are long. Postganglionic fibers in sympathetic, they are long, and in parasympathetic, they are short. The sympathetic ganglia, they are very close to the vertebral column, whereas there are no ganglia such in parasympathetic nervous system. The important function of sympathetic nervous system is to prepare individual to face emergency situation, whereas parasympathetic is concerned in vegetative aspects of day-to-day living, that is digestion, absorption, sexual erection function. The actions of sympathetic nervous system on the organs, mainly it causes dilatation of pupil, increase heart rate, increase blood pressure, provide better perfusion, constrict cutaneous vessels to limit bleeding, decreases threshold in reticular formation and hence increases alertness, increase blood glucose, free acids to provide more energy. Whereas parasympathetic, it decreases the heart rate, decreases the stroke volume and favors storage of absorbed nutrients. The sympathetic is known as catabolic nervous system, whereas parasympathetic is known as anabolic nervous system. Neurotransmitter of the sympathetic, most of the ganglia, they produce acetylcholine, and at the organ they produce adrenaline or noradrenaline. But in parasympathetic, all the ganglia as well as pre or post parasympathetic ganglia, they produces acetylcholine. Some of the difference between somatic nervous system and autonomic nervous system are, so in somatic system there are no ganglia, whereas you can see ganglia at the site of synapse between two efferent neurons. In somatic nervous system, efferent neuron are single between CNS and effector organs. In here, autonomic nervous system, there are two efferent neurons, pre and post ganglionic. Neurotransmitter in somatic nervous system is always acetylcholine. Here it can be acetylcholine, epinephrine or norepinephrine. The somatic innervates smooth muscle, the autonomic nervous system innervates smooth cardiac muscle and glands. The somatic nervous system stimulation affects, it causes excitation. It always causes excitation because inhibition occurs centrally through the inhibitory interneurons. Whereas autonomic nervous system, it leads to either excitation or inhibition according to the receptor which has been stimulated. The spinal column pathway is in the anterior horn cells, whereas for autonomic nervous system, they are the autonomic ganglia. The synapses in somatic nervous system, they are well defined. The autonomic nervous system, they are ill defined. The somatic nervous system, it mainly causes the voluntary movements, whereas autonomic nervous system causes involuntary movements. Other functions like skeletal muscle activity entirely dependent on its nerve supply in somatic nervous system. Here in autonomic nervous system, activities controlled by ANS shows considerable autonomy, and activity is confined to certain muscle group, and the activity is more specialized. These are some of the effects of stimulation of alpha receptors and beta receptor. Alpha receptor causes vasoconstriction, iris dilatation, intestinal relaxation, and intestinal sphincter contraction through alpha 1, piloerector contraction, and bladder sphincter relaxation. Whereas beta receptor, it causes vasodilatation through beta 2, cardio acceleration through beta 1, intestinal relaxation through beta 2, uterus relaxation through beta 2, and bronchodilation through beta 2, and calorigenesis and relaxation of the bladder sphincter through beta 2 receptor.